Pyelonephritis. Pyelon means pelvis and neph refers to a kidney. So in this case, it's the renal pelvis, which is the funnel-like structure of the kidney that drains urine into the ureter, and itis means inflammation. So acute pyelonephritis describes an inflamed kidney that develops relatively quickly, usually as a result of bacterial infection. Now, a urinary tract infection or UTI is any infection of the urinary tract which includes upper portion of the tract, the kidneys and the ureter, and the lower portion of the tract, the bladder and the urethra. So, acute pyelonephritis is a type of upper urinary tract infection. Pyelonephritis is most often caused by ascending infection, meaning bacteria start by colonizing the urethra and bladder, which would be a lower urinary tract infection, and made their way up ureter to the kidney. Therefore, upper UTI shares a lot of some risk factor as lower UTI, female sex, sexual intercourse, endoral catheters, diabetes mellitus, and urinary tract obstruction. One major factor that increases the risk of an upper UTI from a lower UTI spreading upward is vesicoureteral reflux or VUR, which is where urine is allowed to more backward up the urinary tract, which can happen if the vesicoureteral orifice fails. The vesicoureteral orifice is the one-way valve that allows urine to flow from each ureter into the bladder, but not in the reverse direction. VUR can be the result of a primary congenital defect, or it can be caused by bladder outlet obstruction, which increases pressure in the bladder and distorts the valve. Kind of a double whammy obstruction also leads to urinary stasis where urine stands still, which make it easier for bacteria to adhere and colonize the urinary tract. So, for ascending infections that cause acute pyelonephritis, the most common organisms are E. coli, Proteus species, and Enterobacter species, all of which are commonly found in the bowel flora. It's also possible that the kidneys get infected via hematogenous infections or spread through the bloodstream, although this is a lot less common. Usually, pyelonephritis from hematogenous spread is a consequence of septicemia or bacteremia, which is bacteria in the blood, as well as infected endocarditis, an infection of the inner layer of the heart. In this situation, the most common organisms are Staphylococcus species and again E. coli. Acute pyelonephritis is most often unilateral, meaning it affects just one kidney, and when bacteria mount an attacks, they usually start by adhering to the renal epithelium of the tubules, which trigger an inflammatory response. Chemokines attract neutrophils to the renal interstitium that typically the glomeruli and vessels of the kidneys are spared. As neutrophils infiltrate and die off, they make their way through the urinary tract and the feed out. So people with acute pyelonephritis often have white blood cells in the urine. The cells in the surrounding inflammatory proteins debris is even casted into the shape of the tubules, which is then also peed out and is called a white blood cells cast. Patients also can present with increased white blood cells in their blood called leukocytosis, and as a result of an inflammatory immune response, patients can also develop fever, chills, nausea, and vomiting, as well as flank pain at the costovertebral angle. These systemic symptoms are what often distinguish acute pyelonephritis from a lower urinary tract infection. Treatment is typically antibiotics and making sure that the individual stays well hydrated. Like most bacterial infection, there are also a possibility of a renal abscess that can form as a complications. Also, if there are recurrent infections, which can be the case in the people with an anatomic problem that allows bacteria to easily cause infections, then it can lead to chronic pyelonephritis as well as papillary cirrhosis or death of the renal papillary tissues, which has a much worse prognosis because that can affect the kidney overall ability to the function.